Newman. This is a very badly edited version of Ask Dr. Ben. I'm a coronavirus scientist. I'll try to answer your questions. So the next question comes from Nicola. Yeah, the other Nicola. How you doing? Yeah. So, all right. The question is on a different page, so I'm going to try to remember it. It's something like, what if a person is being treated for rheumatoid arthritis? How would that affect vaccination? And the short answer is I haven't seen a study that actually directly looks at this. And so the technical answer is dunno. Yeah. But we can usually do a little better than that by putting the puzzle pieces we do have together into something like a puzzle. So let's try that. All right. So when I heard this, I thought, well, I'm not sure. I think it would be all right, but let's Google it up and see exactly what's going on. So this is a lovely page that I found here at the Mayo Clinic, and so it's talking about some of the most common treatments. The question didn't say exactly what this person might be on, but there's only a limited range of things that a person can be on, and it may be some combination of these as well. First one are the new non-steroidal anti-inflammatory drugs, NSAIDs. These are going to be things like ibuprofen and naproxen and whatever, Advil, Motrin, Aleve, yeah, stuff like that. These are very common pain-relieving drugs, and they all work at the level of blocking one of two enzymes. So the enzymes are called COX-1 and COX-2, which stands for cyclooxygenase, and they turn one compound into another compound. Yeah, make a little circle with an oxygen in it, or break it, I forget. Yeah, but whatever. And these are kind of middlemen in the process that eventually leads to pain. It's a kind of an indirect thing, but it works really well. So yeah, if you don't make any of the products of cyclooxygenase, then you don't feel the pain from it. So yeah, that's neat. Most of the common ones that are on this list, anything with like a normal sounding name, would be one that actually works on both of those enzymes. So COX-1 is always on. COX-2 only gets turned on during inflammation, like when you're sick for some reason. And so here's a little list on this other tab. There we go. These are all the non-selective ones that would hit both. These are the ones that only hit COX-2. Fantastic. And I've never heard of anybody taking those, but you may, because I don't actually deal with this part of the world. Yeah. All right, so what would the effect be? I've looked that up before. There isn't a good line of reasoning that would lead you to suspect there would be anything different about a person on NSAIDs. I think they tell you not to take them just as a precaution, on the idea that maybe, since they're doing something that would indirectly affect some immune cells, maybe it's going to be better if you don't do that thing, just because they haven't tested it. But I don't think there's any reason to believe there would be anything bad that would happen or will be any less effective because you're taking that. Steroids, on the other hand, some of these things can be properly immunosuppressive. So there are different kinds. There will be steroids like, I believe, dexamethasone. Yeah, that should be a steroid. And that's been tested pretty extensively, and at first people thought it might work a little bit, and now we're to the point where looks like it doesn't really do anything. It seemed like it maybe could, as like that its normal side effect of a little bit of immunosuppression might help, but it turns out that there's really not any good clinical evidence that that is the case. There would be other steroid-like drugs that would be involved in like tumor rejection and stuff, but I think that's not what we're talking about here. So yeah, I would say that's something that we thought maybe would have an effect, but now, nah. Disease-modifying anti-rheumatic drugs. And oh my gosh, look who's on the list right there. Hydroxychloroquine. That one has been tested to death, and it does nothing. Oh, there, 0. Not okay, nothing. Against the coronavirus. If you have the virus growing in a flask in the lab and you saturate those cells with just killing amounts of this compound, yeah, you can have some effect on the virus, but nobody's been able to show any real positive effect in humans. And there's many studies that show negative effects as positive effects. So I think probably the truth is right about in the middle. And Yeah, it's just nothing. The rest of these, I've heard of methotrexate being tried. That one was not successful in doing anything against COVID. I haven't seen the studies with either of these. I bet they've been tested, but none of these actually should have any real meaningful effect. But the steroids would be the ones that I would think would have the greatest chance of influencing immunity rather than the DMARDs. And the last thing are the biologic agents, which all the ones that end in UMAB, here we go, adalimumab, those are all monoclonal antibodies. So they're an antibody that'll stick to a thing and basically just stop the thing from working for the most part, or block something that it was going to do just by sticking in it. Just like, in basketball, you play defense by just putting your hand up right over their face. Yeah, just terrible. Yeah. And so there's no good explanation for why any of these very specific antibodies would have any generalized effect that would make a vaccine either more severe or less effective. Now, some of these things are actually associated. Here we go. Yeah, higher doses of this tofectinib can cause an increased risk of blood clots in the lungs. So I would say, if you've got somebody who's on that, they would want to talk to their doctor. That might be a case where you could do the test, and the doctor could look for antibodies against platelet factor 4 with heparin. And that's like a pretty standard test. They would be able to do at any decent-sized hospital. And if somebody has that, then, yeah, they would probably tell you not to get that particular vaccine and use a different vaccine, or hold off and wear a mask until everybody else develops herd immunity and the virus goes away. Other than that, I would say that's the level where your doctor would be definitely the right person to talk to, because they're going to know which of these things has particular side effects. There's nothing general that I can see in any of these that would lead you to have any particular bad effect. Yeah, the bone marrow suppression with some of these things, yeah, it doesn't seem to work in a way that makes any difference in COVID-19. So, yeah, it's a thing, but probably not a thing that super matters right here. So, yeah, excellent question. I definitely learned something, and I appreciate you asking the question, because, yeah, I like when they make me learn. All right. Thanks very much. This is all. This has been Ask Dr. Ben.